here from the beginning in this whole community conversation about Memorial Health Systems. You know, it really started about 2 years ago when Council had a sustainable funding committee actually make recommendations on some of the local city assets that we owned. And one of the recommendations was that Council take a close look at Memorial Hospital and the future for the hospital. So we formed we called it the Memorial Health System Commission, and they worked for, I think it was about 9 months, had over 50 public meetings, brought in experts from all over the country to help us consider the future for Memorial. That group then made a recommendation to Council, which was for Memorial to spin off as a separate nonprofit and sort of separate itself from the city. Well, as time goes on, if it takes too long to make a decision, you have another election and you get a whole new group of elected officials, and that's exactly what happened here. Last April, we had an election. We not only got a new form of government with a new mayor, but we also got 6 new council members who had not been a part of the previous discussions on Memorial. So we sort of started over again. It was a year ago, and this council decided to put together a task force to continue to consider options for Memorial Hospital. And that task force, at the urging of the mayor, actually decided to do an RFP process for a lease for Memorial Hospital so that we could get several different options from organizations. One of the caveats of the RFP where we requested proposals from other health systems in the state was that they had to do business in the state of Colorado. We really wanted to keep keep Memorial and the health care of our community as local as possible, and so we limited the proposals to the state of Colorado. We ended up with 7 proposals from some of the largest health systems in the country. We were really pleased with the variety. We had some for-profit, we had some non-for-profit. We had just a wide range of options. The task force, we went through an extensive process interviewing groups, hearing from them and what they thought they could do for healthcare in the city of Colorado Springs. And when all was said and done, the task force made a recommendation to City Council to go with the University of Colorado Health System out of Denver to lease Memorial Hospital for the next 40 years. We've completed about 6 weeks, a month ago, the actual lease. And we did that in order to have the lease complete with all the details before we went to the ballot. As most of you are here, you probably know that Council has placed this on a special election ballot for August 28th of this year, where the citizens, as owners of Memorial Health System, will actually have the opportunity to vote on whether or not to lease Memorial Hospital to University of Colorado Health System. And I want you to know that we worked very hard on that ballot language so that it was really simple. You know, we all complain about long ballot language that you're not sure whether you should vote yes or no. I think this ballot language will be very clear. Yes, we lease to Memorial or to University of Colorado Health System, or we don't. You know, there are some real advantages, and let me give you a few of the details, and then Merv can give some of his thoughts too. You know, this actually, one of the big things about this is the city stands to gain a lot of money. There's $259 million up front with another $168 million in annual lease payments, which would totals over $1 billion over the life of this lease that will come back to our community. The lease also includes $3 million a year for 40 years towards a Colorado medical school at University at UCCS. There's so many pluses, and I hope we can get into more of them. I'm going to let Merv share from his perspective what he thinks some of those pros really are based upon the lease. Merv and Chris Melcher from the city actually served on the negotiating team to actually complete the lease.